So we're going to work on the pecs and pec minor. Pec minor in particular, I want to go over a little bit of the anatomy. It'll attach at the coracoid process. There's this little bony knob. You'll notice that this is the shoulder, but if you go between this and the collarbone, there's just this little bony knob right here that's actually part of the shoulder blade. Coracoid process, the coracoid, I believe, is short for crow in Greek. It's a beak. It sticks out off of the shoulder blade. The pec minor attaches here and goes down on the ribs. Pec minor is very often involved in cases where people's shoulders are rounding forward, which is very common. And to reverse that, the first thing I want to do is I'm going to get my hand underneath Karina's shoulder blade, and I'm going to sort of tuck her back and then place my hand over the shoulder to lengthen and open this up. She automatically rolled her arm out to the side. This is a very delicate way of accessing and providing a little bit of length there. Gonna jostle and open the pecs and pec minor. The pecs are often what guys are trying to strengthen, make big and bulky when they're doing bench press. The pec major is a much larger muscle. It connects down along the sternum and then up and over towards the shoulder. We've provided a little bit of length there. I'm going to come in along this border and just apply a little bit of pressure. This is below the collarbone. You can see the collarbone right here. You don't want to press above the collarbone. You want to stay below. So right around this area, I'm able to use my hand to go in and apply some pressure there. I like having the hand on the back of the shoulder blade. It allows me a little bit of movement, some jostle there as we work. And Karina, do you like more pressure lateral or medial? Medial. Okay, she wants more medial, going that direction, more towards the midline. Gonna hold there. And does it feel like you could use still more pressure, even more medial than that?
Yeah.
Okay. So I'm gonna remove my hand from the back from that initial spot we were working. I'm going to come a little bit more towards the midline. In this case, I'm going to reach, I think, across the table to make this a bit easier. I'm going to come in. I can use flat hand, but I'm going to use a little bit of the side. I want to get closer to subclavius, which is underneath the collarbone, attaches at the sternum, goes out to the coracoid process. I'm again finding the clavicle right here, just so I can sink below it. There we go. Now the pressure, Karina, do you mean to slide more medially again or more lateral? Lateral this time. I'm going to change my body mechanics. My pressure, if you look from my shoulder to my hand, is down the direction that I'm pressing. How's that right there, Karina? There we go. Now, do you prefer more pressure down towards the feet or up towards the head?
Feels more intense going down.
Okay, it feels a little bit more intense going down, so I'm gonna shift position and we're gonna work both sides at the same time, because now I can pull my fingers in and I'm gonna lean more into this piece of my hand on both sides. This is going to move the first and second ribs around, which is where pec minor inserts. Little spot right. That feels like that's got the most density to me, right there. Karina, how's that?
Feels good.
There we go. Now, if I give you pressure, do you still want pressure down Okay, so I'm gonna lift my seat. I'm gonna stand so I can apply a little bit of pressure right there. How's that? There we go. Working with female clients in particular, or somebody who's female that's receiving from you, you want to be careful about breast tissue and how close you get. There's a very distinct sense when you sink in right here that you're actually working on the rib cage, working on the pec, not towards breast tissue. But I'm going to show you another way to access some of this in a minute that's going to remove some of that issue. Karina and I have worked together many, many times, so I can be a little bit more open with her. Now, if I give you more pressure on the right side, Karina, or on the left side, which do you prefer?
The right.
More the right, okay? I'm gonna lean in more to the right side. And still down towards the feet. Okay. Now she's breathing up and through what I'm pressing on, and that's really ideal. Anytime you're working on people, if you can encourage them to breathe, they're gonna have more of a relaxation response. Tissue seems to unwind and let go more easily that way. This is a little bit of pressure on my hands. After she takes that exhale, I'm gonna slowly back off. I don't want to hop or spring out of that contact. And that gives her a chance to fill her lungs, move around a bit. She feels more on her right side. So what we're going to do is we're going to use a towel. We're going to give Karina a little bit of coverage here, right over this area. And I can still feel down to the clavicle, but what this will allow is I can come in and use a bigger, broader tool like my elbow or forearm. I'm going to lift myself up, come in. You tell me, Karina, is that too sharp? Okay. This guy's sliding, so I'm going to move it over just a bit more. I'm going to be able to use the forearm and elbow, again, below the clavicle. You tell me, Karina, right there? Okay. Now, more lateral or more medial? Lateral. Okay. And then down towards the feet. Too much?
It's really intense.
Okay. So I'm going to support myself with my right hand. Is that better right there? There we go. Now, I could also do this with my hands. I'm actually using the opposite arm. I would often use my right, but because of the way the cameras are set up, it'd be a little bit harder to see. You want to make sure you have wonderful deodorant for this. And as I'm sinking in, if I go just a little bit that way, is that too much, Karina? Okay. Now I can feel the density more towards her sternum, where my elbow is. When I put down the towel there, one of the things that happens is it's going to make my elbow not as sharp. You can see that my forearm is, big and broad over here. It's not at a point. But I can feel the density towards her sternum, and I'm pressing just a little bit down towards her feet. As she was taking a breath in, I started to back off. Now, what you'll notice is because she's covered now, I can come in and work through here and these attachments through the sternum. And because of this additional layer, this additional barrier, I think the clients are more trusting. They understand that we're working on pec and not breast tissue. So let's say I felt like along the sternum right here was a little dense. I'm going to take my prayer hands, little side to side, right in here. Karina, how's that? Okay. Now, when I give you more pressure down towards the feet or up, which one of those do you like?
Down.
Down again? Okay. So I'll give you some pressure down. I'm going to stand, get a little bit of weight. And then what about a little bit side to side? How's that?
Intense.
Intense. Is it too sharp?
No, it's okay.
Okay. I gave her just a little bit less weight. This allows me to work the attachments of pec major along the sternum there in a way that is more comfortable and secure for Karina. It gives me a little bit of sharp with the side of my hand to be able to work these attachments. Most women don't have a chance to have this work. Therapists are afraid of innuendo or any notion of impropriety. But using a towel to be able to come in and work through this slowly builds a huge amount of rapport with my clients. So what about this way, Karina? Not so much? But if I go down,
Really intense.
really intense. Is it too much?
No, it's okay.
Okay. Do you prefer to the right or to the left?
Either, they both fall.
Okay. So when she gives me the either, I'm going to hold in the middle, and I'm going to give her some more pressure down towards the feet. Not too much there. There we go. Now, I was standing, so I'm going to back off. You'll notice that I use the side of hand first. Now, if I take my hand, instead of being completely flat, we'd get too much breast tissue that way. If I pull my hand in like this, I can go to the center. How's that right there? Not too sharp? Okay. And probably less sharp than what we did before, right?
Right.
Okay. So do you see how it's like I slowly build up in intimacy? I'm trying to work the attachments of the pec, but I'm also trying to make sure that the client I'm working on feels comfortable and secure. If I wanted something Karina mentioned before we started shooting, she had a little tension in her neck, I might do this and lift her head into my palm, go back into these pec insertions right at the chest. And this way I'm able to move and mobilize her head while I work on this. How does that feel, Karina? There you go. Right there. How's that? Yeah. Right in the center. If I decide, I can give her some motion. A little bit of length on the neck, making sure she's not hitting my forearm. If I reestablish my grip, I can give her like a little bit of traction. So it's like my left hand is pushing down on the chest while my right hand is tractioning the head up and away. Just feels nice there. Now I can certainly work on the other pec, meaning the left side, but Karina was having more issues and challenges on the right side here. And I'm actually using my fingertips to feel almost like between the ribs. I can feel the collarbone here. And then as I go down, I feel this rib, which I think is the second rib, right there, stand out just a little bit. So I'm going to see if I can use the back of my hand, this kind of edge right here. And then I'm going to use my other hand to reinforce and press there. How's that? There we go. Is that too much?
No, it's fine.
Okay. And I'm just using my fingers, using my hand to reinforce. How's the jostle there? Is that too much? Okay. So, do you like more towards the middle or more lateral? More lateral. Okay. So if I grab right there and press down towards the feet. Good spot. So just a different hand technique. This sort of thing is a small nuance where I'm just basically relaxing my right hand. I'm using my left hand to reinforce. I'm using the left hand to press down into the rib cage. When we work through the pec minor, the subclavius, you're also getting to the intercostals, which are the muscles between the ribs, and they have a huge effect upon respiration. They get used constantly. When you think about ribs, think about the food you eat. Think about short ribs. You have to cook them for a really long time because those muscles get used a lot. They have a huge amount of connective tissue that builds up that has to break down so that it's easy. What do we like with ribs? We like when the bone slides out. That's because the proteins have to break down. When you're thinking about working on intercostals, that's the sort of muscle you're working on, and just like barbecue, low and slow. You can't grill it at very high temperature very fast. It makes it tough and almost impossible to chew. I'm going to give her some space there for a second. Let her breathe again. She took a full breath. And I'm going to come out towards the coracoid process. I'm going to see if from a seated position I can reach down with my forearm and elbow. Right. How's that there, Karina? Is that too sharp?
No.
Does this spot feel tender compared to what we were doing towards the sternum? Towards your...
Less tender.
Less tender? Okay. I'm going to go a little bit more lateral, but this time with my hand. I'm just feeling my way around to see what parts of the pec we're going to work. As I reach out and over, I'm going to lift the towel back so you can see this. I'm essentially reaching down into here to grab the edge of the pec. How's this, Karina?
That's more intense.
More intense. Okay. Now if I grab here, how's that?
Actually feels really good.
That feels really good. Nice. So here's the thing. When I'm working with Karina or any client, there's a sort of exploration and communication that's going on. I might not have started with this because it would have been deemed inappropriate or maybe too intimate initially. But once I've worked on her, I was trying to demonstrate what I was grabbing, but once I did this, totally fine. But we built up to this point where she feels comfortable. So if I have some pressure here, and I've essentially grabbed pec major, if I give you some pressure back towards the shoulder or up towards the chest, which of those do you like?
Second.
Okay, she likes the second one where it's almost like I'm pulling. Now if I go down towards the feet or up towards the head, very different grip than what we had before, but completely fine. When I am working with tissue, I can't tell you when to use a stretch, when to lengthen, when to compress, when to knead, when to rub. Those are all techniques, and they're really going to be applied depending on what Karina is going to respond to. What that means is in session, you're going to have a lot of different tools, but we're not working on a car. As much as we want to know anatomy, musculoskeletal anatomy in particular, you have to understand that we're connecting with Karina, and the number one dictator, the number one predictor of outcomes in session is how Karina feels about me. If she feels safe and protected, she's going to let go. If she does not, it doesn't matter what techniques or tools I use, she's going to be more tight. How's that in there, Karina? Okay. Now my hand was starting to get tired. I'm going to slowly disengage. I'm going to cover her up again. And let's see if I can change the position here. There. And back of hand again. I'm going to use the backs of my hands to knead. This is a little bit closer to breast tissue. So I've covered her up again. I'm a little bit lower on the sternum this time. How's that right there, Karina?
Intense, but feels good.
Intense, but feels good. And that's where I want to hang out. Now, if I give you more pressure, just a little bit down towards the feet or up towards the head. Up, right there. There we go. So I'm going to lift and raise my forearms a little bit. How's the pressure there? Any real change? No? Okay. So slowly for me, Karina, I'm going to have Karina engage her sternocleidomastoids by turning her head from side to side gently. I had to lift my arms to make sure she wouldn't hit me. The SCM, if you would engage both the SCM, sternocleidomastoid, muscle in the neck, at the same time, it would lift the head forward. So I'm just trying to get her to be aware of that. When people shorten into what we call thoracic, I think, flexion, normally what I'm trying to do is back bend people and get them in thoracic extension. I'm just trying to make Karina a little bit more aware of her SCM. And there you go. So Karina, when you're back at the center, can you tuck your chin? And then slowly on an exhale, can you lift your head up forward towards my hands? There you go. You tuck your chin, roll it in, and then slowly, there you go. Lengthen it back for me. I'm gonna slowly, at the end of that exhale, back out. I'm going to give her just a breath or two to sort of recalibrate, sort of come back to equilibrium. Then a little bit more lateral, back of hand again. How's this in here, Karina? Too sharp? Tender?
Not really.
Not really? Okay. So to get into the pecs even a bit more, now we've got her covered. Once we're working this close to breast tissue, I do think for lots of people this is important. I'm below breast tissue here. How's that right there?
That's fine.
Okay. Now, just to give you an example, I'm below breast tissue. You can see the line there. If I start to take fingers and work them between the ribs, how's that, Karina? Very, very sharp. And the thing is, I did that just to demonstrate, like I can work all the way around here, but when you start sliding fingers between intercostals, that can be really, really tender. You can see the look on her face, right? Really sharp. This would be sharp enough on me, but for female clients in particular, female receivers, they don't have people work on these things. I'm gonna have a big, broad grip below breast tissue, but you can see that I'm along this edge here. How does this feel, Karina? Okay. So what I'm going to do is here, I'm going to lift this up so I can get a grip. I'm actually grabbing below breast tissue so I can pull this way. But then what I'm going to do is once I've established, like if I put that much pressure, that's okay? Okay. Does that feel good? Okay. What I'm going to do is put my hand on the shoulder here. We're going to lengthen the pec to start, and then we're going to give a little bit there. How's that? Now, she gave me that good, yummy sigh right there. Now, you can understand that I could do this without the towel down, but if you're working on someone, especially the first time, I think it's important to make sure they feel like they are covered. And we've gone the extra mile. She's clothed, and we've put a towel down. Now, I feel more tenderness back over here. How's that? Pretty tender? That's what I could feel. So what I'm going to do is reach above now. So I'm above and below the breast tissue. I'm going to grab right here. How's that? Yeah. Not too much? Okay. Now, Karina, for you as a female receiver, how does this feel like in regards to breast tissue when a therapist is working on you this way? Does it feel untoward at all?
It doesn't feel like you're touching my breast tissue.
Yeah. See, she was just saying it doesn't feel like I'm touching her breast tissue at all. And that's the whole thing. It's like I'm having to work around the muscular attachments around breast tissue. And when it comes to the pec in particular, it's really, really important to be able to get in and work on these areas, but also make her feel comfortable and for me to feel comfortable at the same time. So I'm going to come back down up to the head of the table, see if we can get another option here. Because she was responding well to that pressure down below, I'm gonna lift her up, see if I can get my hand here. There we go. So right there, Karina, how's that? Is that too much pressure where the hand is pressing? Okay. And then I'm gonna give some pec pressure at the same time. I'm really just exploring, just based on Karina's response. If I give you some pressure right there, how's that? Okay. Now with both of these, if I give you pressure kind kind of up and over or back and down. Back and down. I'm going to grab a little bit higher with this hand right there. How's that? So we're working around the rib cage. When we're working the rib cage, pressing on the ribs, we're accessing those intercostals we talked about that can be really tight. We're always just trying to create safe space where Karina's sense of strong, nurturing intimacy is set up in such a way that she can relax, release, let go. If you're working on someone this way, one of the things you really need is confidence. When I talk to massage therapists in school, they're inordinately nervous working around breast tissue, and I think for good reason, because they don't want to make somebody offended or cause an issue. But if you do these things confidently, it makes a big difference, and having a towel makes all the difference in the world to me personally. I'm going to put this back down, and I'm going to reach across. Let's see. Right there, Karina. So I'm going to use these two fingers. I found these ribs right here, right at the sternum. How's that right there, Karina?
Feels good but intense.
Feels good but intense. I'm going to use these other fingers just to reinforce those two. Right there. How's that? Now you have to do this slowly. We're sinking in. We built up to intercostals, right? Right along the sternum. I'm going to go just a little bit more lateral. There we go. So if I give you pressure, do you want pressure more laterally or more medial?
They're both intense.
Both intense. So I'm going to go in the middle. I'm going to hang out right there. I'm just going to have her breathe for me. And then I can give her pressure down towards the feet or up towards the head. Okay, she likes down towards the feet. Now I can feel the edges of the ribs, but I'm not sinking down so deeply between the ribs that I can't press up or down. Mainly, when you keep in mind what we're doing, we're making contact with skin. I do feel tissue, I do feel muscle underneath, but primarily what we're doing is making contact with skin, providing a stimulus and allowing her nervous system to respond. There we go. I'm going to slowly back out. You can probably see here, yep, a couple little red marks right where I was. How's that feel, Karina?
Feels good.
Cool. Thank you so much for allowing me to work on you today.
Thank you.
You can check out our full pain relief series on Amazon Prime or on WellnessPlus TV when you subscribe. In my 15 years experience as a yoga teacher and massage therapist, I've blended techniques to be able to help students consistently with flexibility, mobility, and by helping them decrease pain in their bodies. As I work with those students to embody, I'm sharing those same techniques with you in this yoga massage course to help you connect with students, increase rapport, and help students just like I have. You're going to be able to, in following the series, work on yourself, help the students work on themselves so that they can embody, and you can be a rock star teacher for helping students feel comfortable being their own best educator.